Hi, my name is Yeshna, and today I'm going to talk about how to approach pediatric cases in NAC OSCE. This is just my way of approaching it. There are many different approaches out there. And the first thing that's important is to properly introduce yourself and making sure that you establish what relationship the caregiver has with the pediatric patient. And especially after that, it's very important that you assure confidentiality in especially teenagers. They would be reluctant to release information, and if you notice any resistance in giving you information, again assure confidentiality. So organization of the blue book, you can start off with the chief complaint, which is written at the front door, the name of the patient, age, vitals if provided. If you don't have time to write that, it's also provided inside the examination room. And make sure that you write your differential diagnosis, at least 5, to be able to ask about those in your associated symptoms. And pick a mnemonic that works with you. There are many out there. And one of them that I use is OCD, onset course duration. S is for setting, and F is for frequency. And analysis of the chief complaint through PQRTAA, so progress, quality of, for example, the pain, radiation, any triggers, alleviating factors, aggravating factors. And for pediatric patients is always, especially for patients less than 6 months old, I always ask about their general appearance, how does the baby look, are they active, sleeping well, and then make sure that you go through the review of system, analyzing head to toe, ruling out any upper respiratory tract infection, meningitis, any otitis media, things like that. And then you move on to past medical history, the any allergies, any medications they are on, hospitalization, family history, and then social history. In social history, make sure that you know who spends the most time with the children. If you suspect any signs of child neglect, that would be a good place to find out. And note the different age categories. That's very important for the following slides when you will ask more questions on these different categories. So for patients 0 to 11 years old, I always go through this mnemonic BINDE. So BINDE is for birth, B is for birth history. So you can ask if it's a 0 to 6 months old. I would always ask about the antenatal history, so the pregnancy, how did it go for the mother, if they were going under regular follow-ups with their doctor, having ultrasounds, any complications during pregnancy, things like that. And then I is for immunization status, N is for nutrition, D is for developmental, milestones that we'll talk about in the future slide. And then D also for daycare, if you suspect the patient has any ill contacts, for example, if they have diarrhea or fever, you can ask that there. E is for environment, so who do they live with and how is their relationship with everybody at home, with their friends. For patients 12 to 18 years old, typically the adolescents, I go through the mnemonic heads. So make sure that you ask about the home environment, the environment, especially the performance at school. And A would be the activities, if they are still doing the things that they love doing, or have they disconnected from that because of their self-esteem, things like that. D for drugs, so if they are on any, some patients, adolescent patients like to experiment, so it's a good place to ask about any drug use, recreational drug use. And S, especially you can transition into sex by asking about if they are currently in a relationship, and if they are currently sexually active, and having proper, um, sorry, any condom use, protection use, like that. And then S again here, so if you ask it in the social history, here you don't have to repeat it, but if you don't, here you can ask about the social history. Yeah. So developmental milestones, these are the milestones that are found in Master the Board's book. So those are the main ones that you want to go through, and especially, let's say, for here, 9 months, you want to know the patient, if they are pincer grasping, because they could be playing with toys and putting something in their mouth, just because at that developmental milestone they are playing around with they're playing around and grabbing stuff to put in their mouth, and they can have foreign body aspiration. And yeah, for counseling cases, you may have different people you're going to talk to in pediatric cases, and it could be also a phone conversation. So make sure that you know who you're talking to if it's by phone, the parents, grandparents, and if they are the main caregivers, where are the other people in the uh, care circle for the patient. Um, and then for them as well, always assure confidentiality. And consider organizing your blue sheet. I know sometimes with counseling you don't know where you can go with the topic, so make sure you have like a general template that you can use. So for example, one approach that you can talk about counseling would be something like that you can organize in your blue sheet, blue book, sorry. So the concerns of the patient, perspective, what do they know about, for example, vaccines, where did they hear that from, where did they get that information from, and then ask permission if they are willing to listen to what you have to say, and that your knowledge comes from evidence-based medicine and from research, and then you share your knowledge if they are receptive. Make sure you talk about the risk versus the benefits, and as you're talking about that, make sure you're checking their understanding, regularly checking with the patient, make sure make sure to ask if they are following with you. Talk about the side effects if it's about vaccines or any new medication that's being introduced to them, and talk to them about where to go for follow-up if they have any emergent symptoms such as anaphylaxis after using any medication, any new medication, or any yeah, things like that. And make sure you also direct the patient to different resources. If you're providing brochure, make sure that they understand and they are at the proper level of education to read through. Um, and make sure that you connect them with other support groups if they're going through difficult times as well. And be understanding to the parents, and empathy is very important in these cases, especially for parents. So make sure that you um, talk to the parents, and make sure that they know that how hard it is, and how you appreciate the effort they are making to help their children. So for closure, allow at least 1 minute to close properly, as I mentioned. If the parent is on the phone, make sure that you address if they have any financial problem or any financial problem, or any difficulty with coming to the hospital. Also emphasize on the importance of physical exam to accurately and safely diagnose the patient. Um, and if you suspect abuse, make sure that you let the caregiver know that you have to report. It's your job to report to the Child Protective Services, and give them a notification, the caregivers, what to expect, and be non-confrontational, be non-judgmental, and tell them it's just following up with what you observed and for the safety of the child. If it's very severe case of abuse or neglect, um, offer non, you have to tell the caregiver that it would be better if the child stay at the hospital until the proper authorities take over, for the safety of the child again. Okay, thank you, and I hope this helped you in your exam.